because it is very early and not a lot of people are up at 8. All right. Now I'm trying to see if I can get connected with my Instagram. I am connected on StreamYard. What it is that we do here at SBL Hair. Now, I am a hairstylist by trade. I became a hairstylist while I was in high school. I took advantage of the program where you go to your local technical school, you learn your craft, and you still graduate from high school. Thank you so much for my hearts. Good morning, Kitty. I have been a hairstylist since 1987, since I graduated high school. So that's quite a long time, 40 years. And over the time me becoming a hairstylist, I actually also became a trichologist. And as a trichologist, we assist clients with hair growth and helping everyone understand some of the lifestyle factors and some of the factors that they face and some things that they do, the medications that they're on, whatever it is that their hair, skin, body, and scalp are showing. We help clients make sense of that by helping them understand what it is that they're exposed to, how they're living, eating, sleeping, drinking, what their blood types say, what medications they're on. We tell everyone how all of that relates to where they are now and why they are having the challenges they have. Often, as a trichologist, I have to kind of trace back through like dates and times, and I'll ask my clients how they felt when they were a child, how they felt when they were going through puberty, how they felt as a young adult, how they felt in college, up to now, because patterns appear to me and they make sense, and I'm able to say, you're having issues with psoriasis, you're having issues with immunity, you're having issues with dermatitis, you have a weak gut. And then when my clients tell me, oh, well, I've always had this problem ever since I was younger, that's how I'm able to trace it back and tell you today, this is why you're having that issue, because when you trace back, you live a life of possibly being on antibiotics, or you had weak gut health, or you were always on milk products, and you had inflammation in the gut. Inflammation in the gut, eventually, all of the issues that we face, sometimes the body has had enough and it just cannot handle it. And it's going to start showing you through your skin, your scalp, and your hair that these problems are affecting you. I'm showing you through your hair and your skin and your scalp. I need you to do something about it. But many people don't acknowledge it because they don't know that something is actually off. The way you get used to living, a lot of people just get used to it and assume that it's normal, but it's not normal. So I'm here today because I am always on different medical journals, because these medical journals help me navigate how to help my clients, how to help my students. It helps me by learning. As a trichologist, I'm learning each and every day, and I'm learning so much all the time. When a trichologist does not continue their study, sometimes we get complacent, and there are things that we just need to stay on top of daily. So I came across this article, and if you guys can see it on TikTok, it talks about one blood type appears to carry a higher risk of type 2 diabetes. So Facebook, this is the article, and if you can see, it's from something called Science Direct. Now, for YouTube and Facebook and IG, on my business pages, this is the article. And if you guys want to know more about this article, all you have to do is send me a comment or an inbox and I'll send it to you. But if your profiles are private or we're not connected, you have to make your private open, your page open, because I can't send you anything if we're not connected. So I help clients make sense of how they're living, their diet, their lifestyle, all those factors, and how and why it relates to their hair growth or hair loss. So I'm here today talking about this article, and I want to know what you think, because there are no right or wrong answers. This is really just to open up dialogue. I have spoken with many physicians, and many physicians, dietitians, I've had people tell me, oh, blood type, it doesn't matter. It doesn't matter if you have a certain blood type, if you eat for your blood type. I really do believe it does, And the book that I'm referencing is called Eat Right for Your Type. And if you guys want to hold on for a second, I'll go grab the book. Give me a second. So I want y'all to tell me if you have heard of this before, because a lot of people, when I meet them and when I have them finally in my Trichology Center, a lot of people say, "Oh, I've heard that book before, and I heard a little bit about it, but I didn't follow it. I did follow it." This is the book. It's called Eat Right for Your Type. Eat Right for Your Type. Now, this book coordinates with this article. I'm, well, let me say I'm coordinating it and I'm relating it to the article because this book, Eat Right for Your Type, will help you reduce inflammation. Now, I'm going to talk about this article because you guys on Facebook, Instagram, you guys can't see it. YouTube, you can't see the article. So I am going to just talk about this article really quick, everybody, since you guys are not looking at it. So this is from sciencealert.com. It says one blood type appears to carry a higher risk of type 2 diabetes. Now, type 1, where that is actually a different type. Blood types, these are often related to having diabetes mellitus or mellitus. And it says people with blood type B may need to be a little more vigilant than their peers about the lifestyle factors associated with diabetes risk. According to a 2024 Umbrella review, people with blood type B, either positive or negative, had a slightly higher risk of developing type 2 diabetes than people with non-blood type B types. How much higher? 28%. That's almost, one quarter, a little over 25% of everyone on the earth, this affects them. It says that's not huge, but it may be significant enough to tip the scales if other risk factors are involved. Numerous systematic reviews with meta-analysis have been published, which explore correlations between ABO and rhesus blood type groups with various health outcomes. However, to date, the association between these blood groups and human health outcomes remains controversial, which doctors say all the time, and this was written and led by a team of epidemiologists, and his name is Feng Hualu of Shengjing Hospital of China Medical University. The current umbrella review included 51 systematic reviews with meta-analysis and articles with 270 associations. It says we recalculated each association and found only one instance with convincing evidence for an association between blood type B and type 2 diabetes mellitus risk compared with a non-B group. And here it has a little bit more information about all of the blood types, A, AB, B, and O. So again, if you guys want some of this information, I can send it to you. So tell me so far before I get into this, tell me what it is that you think. And there's no right or wrong answer. This is just really to open up a discussion. And this is really just to, oh, Kitty, you were sent here from the FYP page, and Patricia Wilson, you too. Thank you so much for joining me. So tell me what you think about what it is that I just read. And again, if you want to know more about it, just, send me some information in the chat or send me an inbox and I'll send you this, because this is what I use as one of the things for my clients to help them in their treatment plan. When clients are hoping to restore hair growth naturally, when they don't want to do it with medication or with medication, because a lot of my clients that I see are currently on medication. My goal is to help my clients become aware of the lifestyle factors that they're under, that they're up against, that they are faced with every day. Help them reduce inflammation, help them receive some kind of balance, because when your body is balanced, you can grow hair well. And as long as your body is out of balance, you're not going to be able to grow hair well. And that's any type of issue. If you have one small spot in the back of your head that just never grows, if you have constant inflammation and itching, if your hair is getting thin on the top, your body is out of balance for some reason. And as a trichologist, it's my goal to find out what the imbalances are, help you address them so that you can work on reducing inflammation over time, reducing some of the hormonal disturbances, reducing some of your risks over time. It takes time. It's not as simple as, oh, I'm gonna just put some Botana oil on my scalp. And I'm not hating Botana oil, but what I'm saying to everyone else is you can't treat the outside with oil and think that you're going to magically grow your hair back. That's not how life works. You have to address the lifestyle factors that are contributing to you presenting with the outside issue. So if you're having things like dermatitis and seborrhea and psoriasis and scales, it's coming from a lot of different places. It's never just one. And as I learned through the holistic practitioner and trichology, if you are a hairstylist on this call, I I implore you to become a holistic practitioner of trichology because you will learn so much by associating yourself with a group. Her name is Nadia Hughes, and she helps stylists who are already hair loss practitioners or already trichologists. You learn much more about how to address trichological issues when you learn holistically from a place of whole living, where all of it comes from. So let me go ahead and get into it because, like I said, I only wanted to be here for an hour, and you guys know that I can talk. At any point, if you have any questions, just put them in the chat, and I'll try my best to address them while I'm here. So on, let me see if I can pin this. Can I pin this real quick? Yeah, there we go. Get in the comment. Okay. So Toad said, can long-term lithium use due to bipolar issues cause seborrhea? I don't know a lot about lithium. All I know is anything that you take in as a medication, it can cause some systemic issues, and it may change how well your body performs generally. I don't know enough about lithium to tell you if it will cause seborrhea, but I will say this: as long as you strengthen and support your gut health, reduce the yeast, reduce fungus, make sure you're getting in your pre and probiotic fiber, and making sure you're reducing inflammation, getting in your omegas. As long as you protect your gut, so you can reduce your own risk to seborrhea. But if you're not watching what it is that you eat, if you're eating anything under the rainbow because you think you can, you will continue to have issues with seborrhea. So take lithium out of the equation. If you don't treat your body and your gut the way it should, you will continue to have seborrhea no matter what kind of medication you are currently under. So you have to address the issues that the gut needs in order for you to overcome seborrhea, because that is a gut and a thyroid issue. And anytime your gut is off, you will indirectly cause issues for your thyroid because your gut is not moving properly. Proper hormone conversion, especially for the thyroid, can't take place when you have an inflamed, weak gut that doesn't have good transit time. So I hope that helps answer your question. So strengthen that gut. You can help yourself with your seborrhea, but I don't know anything about lithium and how it may affect you. I just know lithium is something that one takes for mood disorders, but I don't think it directly causes any issues with seborrhea. I have no idea. It can cause gut issues. I don't know. So strengthen your gut. And if you need additional support and help, all you got to do is reach out to me, and I'll talk you through some things, and I could possibly help you virtually if you need any assistance. So that is the article. What I want to share with you is, as a diabetic, either you're type 1 or type 2, it can cause issues for your hair and scalp hormonally. Now, I know many of you follow me, and I put on my Facebook, my hair loss page of Facebook. I put it on my Instagram. I put it on YouTube. I talk about it on my TikTok all the time. Hormonal changes in your hair and scalp, anything that is above the eyebrow, this is that hormonal zone. And when you are affecting any hormone in the body, it will cause different issues with the hair on the top of your scalp. It can increase inflammation. It can increase sebum production. It can contribute to inflammation. It can also give you 3 visible types of hairs: terminal, vellus, and miniaturized types of hairs. So when I'm looking at someone's scalp, I know they're having hormonal challenges because it will present itself on the scalp in a certain way. If the hair strands have 3 different types, or there are markedly different sized follicles on the scalp, I know you're having a challenge with the hormone. I just have to figure out which one it is. So today I'm talking about diabetes and blood types and how it relates to you. So for someone with this type of issue, they will eventually end up in my chair and they will have hormonal disturbances from the blood type B, from the diabetes mellitus, from the unstable levels of insulin. So let me share with you why I'm here and why I brought this up this week. I often talk also about inflammation. I wrote a book about inflammation. If anybody likes to read and you want to know how to work on controlling some of your inflammation and where does it come from, please check my book out. I can send you the links to the book on inflammation. But what I share with everyone is when you're having problems with inflammation, you can always take things to reduce your inflammation. You can take OPCs, you can take omegas, you can take turmeric and things like that. But what I say to you is address where the inflammation is coming from. If you can address where it's coming from, then you're better at controlling and calming the inflammation and keeping it at bay. You'll never totally get rid of it because as we age, that's just what happens with the body. The joints don't work as well, the heart doesn't flow as fast, the stomach and the digestion doesn't work as well. So we develop inflammation as a consequence of aging, but we have to go down fighting. So Melissa on TikTok, let me pin this, Melissa. Thank you for your comment. So Melissa said a lot of doctors complain they don't want to run testing. You know what? You can't always fault the doctors. They have a limited time in their day to address certain issues. They got to get you in and out. And then also as a consequence, that's the insurance companies as well. Insurance companies aren't willing to cover everything and they're not willing to allow you to just get a whole bunch of panels run for things that they don't believe aren't related. Sometimes if you have your HSA or FSA or you can spare the expense of getting these tests run on your own, you can do that because you can go to your local lab. Here where I am in the Atlantic County of New Jersey, we have LabCorp. That's like the main lab. You can also go to Quest because sometimes in New Jersey I'll send paperwork out to people in northern New Jersey who have more Quest labs than LabCorp labs. And if you pay for it, you can just pay to get your own blood types, your own testing done, but it does come with a cost. And I understand, but it's not always the doctors. They are up against things, and then it's the insurance company that prevents you from getting all that done too. But you just have to pay for it. So when I'm talking with you all about finding out where your inflammation comes from, this is why I'm here today. I'm talking about blood type B and the association with type 2 diabetes mellitus risk. You're welcome, sis. Thank you. And please, if you can, keep tapping that screen, share this out to people who may want to know about it. And if you can, tap this little white heart here, tap it and go all the way down on the side of the page, leave a comment, tap the hearts, share it out, please, because TikTok will share this with more people because you're engaging with this page. So the inflammation comes from the blood type B being exposed to diabetes type 2 risk. So what I want to share with you is when you're type A, type B, type AB, or type O, different sugars will present on your cell surface when you're a different blood type. Type Bs have a 28% more risk of becoming a diabetic because of their diet and lifestyle factors. That's what the article was talking about. So for me as a trichologist, why I'm here is when I meet with you all and you come in for your evaluations, when I find out your symptoms, when you tell me what it is that you're going through, sometimes I already know when my clients are coming in with upper GI distress, gut distress, diabetes risk, when they're coming in with massive inflammation, when they're on certain types of medication. I already know. I kind of already know in my mind they're a B or they're a O or they're A, they're AB because of the same things that I see all the time. So the inflammation will come from an organ. So no matter how many anti-inflammatories you take, you have to identify where is the inflammation coming from. So today's discussion is really going to address the upper GI. Now I'm trying to share this on all of my platforms so this will make sense. So you have the stomach on the left-hand side. You have the pancreas behind. You have the liver on the right side. And then you have the gallbladder. All of these work in tandem. The stomach digests food. The liver detoxifies the body. The pancreas secretes insulin, and the gallbladder stores bile. If you have a gallbladder, it stores the bile so that you can digest fat. When you're not able to digest your food properly, it will create inflammation risk. When you are eating foods that your blood type does not agree with, you will essentially create more antigen risk, more thicker blood, and the ability for your blood type to get more sugars presented on the cell surface. Now, let me read this again because I want to share with you what it says here. So it says here in the article, human blood is categorized into 8 main groups based on sugars and proteins or lack thereof that present on the surface of your red blood cells. So if you're a blood type B, you have to manage how you eat, because when you're eating foods that don't agree with you, you have more of a tendency to have thicker blood and present more sugars on your cell surface. So as a trichologist, when it shows up on your scalp as redness, inflammation, a whole bunch of yeast, fungus, and when you reach out to these dermatologists and the dermatologists put you on clobetasol and steroid creams, steroid liquids, and fungal products and antibiotics, this is where it's coming from. It's coming from your gut and your inability to manage how well your body is presenting these sugars on the cell surface. So you have to work with someone like me who will break that down for you and let you know, based on your blood type, you need to control how you eat so that you're not having so much inflammation, so you're not having so much yeast and fungus and inflammation in your body and in your gut. So blood type B and blood type O, I see it all the time when they come in and they tell me that they're having issues with their blood sugar. Sometimes when I see it on the scans, different things will come up where I know you're not managing your blood sugar well at all. I will see that you're having either a problem with the way that you eat, you're under a huge amount of stress, your HPA axis is on fire, because when your HPA axis, your hypothalamus, pituitary, and adrenal axis, when you show certain issues that come up on my blood scans and blood reports here, when I see that you're dealing with high levels of insulin, you're dealing with insulin resistance, I already know that you're usually, this is not a fact, you're usually a B or an O, blood type B or an O. So then I have to walk backwards to helping my client identify. You have to make sure that you're digesting your food properly, that you're eating the right fats, that you're helping the liver, because the liver, when you don't have a gallbladder, or when you do, the liver is going to store bile into the gallbladder so that you can digest fat. If you're not managing what it is that you eat based on your blood type, you're going to have a higher propensity to have issues with insulin and blood sugar and insulin resistance. This is all the reason why I see all of that thin hair and that inflammation and that yeast and that fungus and that seborrhea, because of all of this. So you have to mind your house. Now, I've been talking all week about this uninvited guest that you let into your home. The uninvited guest is the high blood sugar. The uninvited guest is the diabetes. The uninvited guest is your lifestyle. All of these things that you're allowing your body to go through, this is why you're having hair loss, sensitivity, thinning on the top, and you don't know why. You just say, well, my doctor put me on this medication, and my doctor said my blood work was fine. For someone like me, when we run your blood types and give you scans, we see things that are, we're able to point out different things by evaluating your blood work. So just because you go to a physician and the physician says your blood work is normal, your physician is not a trichologist. Your physician is not an integrative wellness professional like myself. I take everything, and put it under a microscope and give you a bird's eye view of how everything in your body is associated with your current symptoms and what you're experiencing. I take your stress, your diet, your sleep schedule, how you menstruate, how you don't menstruate, how you digest food, how your gut is acting, your immune health. I take everything. What happened to you when you were a child, your trauma, your stress, I take all of that. The doctor is a specialist in what it is that he or she does. They're not taking all of those lifestyle factors and bringing them interview for you. That's what we do as trichologists. And this is why when my clients come in, I know y'all get sick of me saying to you all the time, oh, okay, Luan, okay. I know you do, but this is what I do. And I read, I study, I try to become acquainted and familiar with a lot of things so that I provide you with more value. And I know my clients get so sick of me telling them about their lifestyle and tell me what medications you're on, how you're feeling this week, and please don't eat this, don't eat that. That's what it is that we do. When we notice something, we're going to share it with you. And whether you think it's valuable or not, it's valuable to us, which is why we share it. So how all of this creates inflammation and eventual hair loss for you is all four of these things are not cooperating properly for you. Your diet and your lifestyle is not helping your stomach, your pancreas, your liver, and your gallbladder. You have to find out what your blood type is, everybody, and eat according to your type. Type A's and ABs tend to have lower stomach acid. They tend to need more help with digesting food because how blood types were broken down. O was the original hunter-gatherer. But then as those type O's moved to other places in the world, they had different meat, different game, different plants, different trees. So those people eventually migrated to different places. They had their children subsequently became different blood types because what they might have had in Africa, they didn't have in New Zealand. They might not have had in China. So they had to eat and adopt different lifestyles. So these different lifestyles became different types of blood types because there was originally just O. So ABs tend to thrive better on less meat because their bodies cannot break down fat as well as someone that's a B or an O. So in A's and ABs, they really should lend themselves to having more fish, more soy, turkey, or chicken, and then a lot of plants and grains. Now for B's and O's, grains are not your friend. Potatoes, wheat, starches, glutens are not your friend when you're B's and O's because type B's, as I said, tend to have more issues with diabetes. So a lot of starches are not your friend when you're a B or an O. More protein and more fat is better for B's and O's because of what eventually begins to happen, problems with metabolic issues and blood sugar. So you need more good fats for your liver or your gallbladder. And those fats will help keep your blood sugar stable longer when you remove wheats, glutens, pastas, and different things like that from your diet. More quinoa, couscous, and things like that are better for blood types B and O. And I know that's probably not the best, but staying away from wheat bread, rye bread, any types of bread, any gluten, pastas, it's better for you to have more healthy proteins, fats, and less carbs that are from the starch type. Now, I say this with all love. You don't have to, believe me, this is just what I see on a weekly basis, daily basis. And when I work with clients, this is usually what I'm suggesting. I evaluate my client's nutrition and I look over it for 2 weeks. I compare it against what it is that I see when they come in. And I'm like, this is why you're having a lot of this challenge because of what it is that you're eating. Many people don't understand until they either read this book or they meet someone like me and I point all this stuff out to them and then I show them the correlations. Correlation does not necessarily mean causation, but it does help when you can remove a lot from your diet that is not inherently right for you as shown in this book. So correlation and causation are not the same, but it makes a lot of sense to me. So this is why I recommend it to my clients. So when you are blood type B or you run the risk of being a type 2 diabetic or you're pre-diabetic, you will always have a hormonal disturbance. And the reason why I say that, okay, Saturn, I'm gonna go to it in just a second. The reason why I keep mentioning your diet, your lifestyle, your blood type, hormonal disturbances is because this is what I see all the time. Thinning hair in this crown, thinning hair, thinning hair, thinning hair. Now that's not the type of thinning that I'm talking about if you kind of were off on your iron for a while. Sometimes people will start to lose their hair. Sometimes their hair all of the strands will miniaturize and all of the hairs will be all of the same size, but I can tell there's a lack of density because all of the strands will be thinner. So I know systemically something is happening. That's not what I'm talking about. I'm talking about when I see three different types, terminal, vellus, and miniaturized strands on the top of the scalp, I know you're having a challenge with some sort of hormonal imbalance. So Saturn's moonchild said, are sweet potatoes okay for blood type? If you had to have any potatoes at all, I definitely would recommend sweet potatoes, but you still have to minimize. I would say if you're going to have sweet potatoes as opposed to white, no more than a cup for your type because it's still a starch. Even though it's better for you and it's recommended here in the book, and I would strongly suggest everybody go over to Google Play or their app store for iPhones and go get that app because you don't have to believe me. Just believe what your body is telling you because your body will tell you what you need to do. But a lot of times you guys aren't listening. This is why I'm always here trying to connect with you all in any kind of way that I can through video, through print, through um, leaving you small clips. This is why I do what I do because I need this to resonate with one person. I don't have to resonate with all of y'all. I don't care if you believe it or not. But somebody, this is going to resonate with one person. And that's the only person I need to reach is one. So Saturn's moonchild said, that's really good to know that I've experienced so much thinning. So, I would just say, get your own personal treatment plan. This is the name of the book, A-Star. Eat Right for Your Type. And there are different authors of different similar books. So even if you got that one, it's good, but you can just get another one that talks about blood types. So, Miss Gail, I don't know what that is. APL again. If you can tell me what that is in no shorthand, because I don't know what no APL again is. Write it out. I'm not good with the shorthand. So I routinely see a lot of dandruff, a lot of yeast, a lot of fungus, a lot of dermatitis, and dermatitis is only skin inflammation. Derma is skin, inflammation is the itis. So I see a lot of dermatitis, a lot of yeast, a lot of dandruff, a lot of pityriasis, a lot of scale, and that comes from an unmanaged gut or gut with a lot of inflammation where there's not enough microbial balance in the gut. There's not enough pre and probiotic fiber in the gut. So the app is Eat Right for Your Type. Let me see if I can pull it up. I have a lot of phones, and I know sometimes when I'm on a lot of different media, this is the media. It's called Eat Right for Your Type. It's the app. It looks the same as the book. So when you go to the app store, it'll say Eat Right for Your Type. And just make sure you get the right one. And it doesn't matter if they have more than one, they're all the same. They're all going to be talking about the same thing. So I'll see a lot of people with those issues, a lot of yeast, fungus, dandruff, scale, pityriasis is called scale. I'll see a lot of inflammation, and I'll relate it back to whatever my clients are experiencing, especially when it comes to the blood type, because I'm able to kind of snip it out quickly. Sometimes when I meet with people on the 15-minute call and they tell me what they're experiencing, I can't necessarily go into, well, this is what I think it is because I haven't met them yet. But usually by what they're describing, I already know what their issues are. And that's what we do as trachologists. Again, when I see yeast, fungus, dandruff, scale, inflammation, and I see miniaturized hairs, I know you're having a challenge with a hormonal disturbance. Hormonal disturbance comes from the imbalance of insulin. Insulin is a hormone. So, and I'm not talking about the kind of insulin you take if you're having a challenge with diabetes, because everyone is so quick to say to me, well, I'm not on insulin. It's a difference. Everyone secretes insulin from the pancreas. That's why I mentioned earlier, if you're a blood type B or you have diabetes type 2 mellitus or mellitus, or if you are suffering with those types of issues, you're having a challenge with insulin, possibly insulin resistance, period. Everyone secretes insulin. If you have pancreas, you secrete insulin. So I'm not talking about the kind that you inject into your body or into your stomach or you have the patch. I'm not talking about that. I'm talking about the fact that you will have an imbalance in insulin, which will give you that hormonal disturbance on the top of your head. So when your hair starts to get thin with time, This may be what it relates to if you're a blood type B or you have diabetes. This is probably what it relates to, an imbalance in the stomach, the liver, the pancreas, and the gallbladder. So, Von Queen, do you think they can open follicles again once they close? That is that that's subjective. I don't know. I can't say yes or no because I don't know what you are particularly experiencing. I don't know what your follicles look like, and I don't know what you are up against, what you're going through, and what your lifestyle tells me, and what you are currently experiencing. I don't know the whole of you to answer that question. That's why I always tell everyone, meet with me for a 15-minute call, work with me through one of my packages to get your personal treatment plan. We assess your scalp, we look at your scalp, and if we see follicles, there's a chance that you can regrow your hair. Often, follicles are dormant because there's something that the body is being presented with that it is focusing on that and it's just not producing hair at the moment. Sometimes when you help the body figure out what it needs, sometimes hair is able to grow. Also, some things that happen is there'll be a lot of biofilm and a lot of um, biofilm comes from the body trying to protect itself, and it will form a lot of calcium and scale on the skin, preventing the scalp from growing hair. There are a lot of moving parts for me to answer that question. So, Vaughn, I don't know. I would have to see your scalp with a hair and scalp exam through one of my platforms. Once you meet with me and you eventually allow me to see your scalp, and once I'm able to identify some of the things that's going on with your body, then I can help you answer that question. But I can't answer that loaded question when I don't know you well enough to be able to answer that. And I apologize. So when your hair is getting thin with time, you're welcome, Miss Gail. It can be from a systemic issue or it can be from a hormonal issue. So I'm talking about a hormonal issue right now. So how can you address this issue? What I need for you to do, everybody, is get your own treatment plan. When I put up clips on my social channels, people always say, well, tell me how to fix it. I can't tell you how to fix it. Because I don't know you, I haven't met you. I don't know what you need. But I tell everyone, if you have a hair loss professional in your area, go to your hair loss professional. Get your team to help you with your own personal treatment plan. Get your dermatologist. Go to your dermatologist. Let them examine your scalp. Go to your endocrinologist if you're dealing with diabetes and you're being medicated. Visit a trichologist. Like myself, I'm in Pleasantville, New Jersey. Work with someone like me and take all of what it is that you're getting as far as information and use it. If you don't reach out to the coordinated professionals, you can't get your own personal treatment plan. So that's how you fix it. A lot of people can go on Dr. Google, find out what it is they need. Some people need more targeted help and more of a targeted assessment. So that's what I help do, is provide you an assessment based on what it is that I see, based on your blood type, based on your nutrition, based on your diet and your lifestyle. I'll put a plan together for you, and you take that to your doctor and you just say, well, look, can I take this medication with my current, can I take this herb with this current medication because I met with a trichologist and she put me on this plan. Go to your HRT professional. See how you can loop everybody in, because you need your team, you need your village. Often it's hard for you to do it alone. When you've been trying to work on your hair growth and your hair loss and your hair thinning on your own for so long, sometimes because you're not a hair loss professional, you can't fix it because you're not me. I just help you put the pieces together. I give you your own plan. You go visit your other professionals, and then you take it all together and you work on whatever it is that you can work on so that you can get balance in your body and get your own hair back. So that's what I say when people say, well, how can I fix it? What can I do? Get your own treatment plan. But for you to do that, you have to meet with professionals. I don't give blanket free advice because I don't know you. I need data. And through data, that's how I'm able to give you your personal plan. So at SBO Hair Loss here in Pleasantville, whether it's virtually or in person, this is what I do. So how I serve you all best is I try to get all of you to meet with me for a 15-minute call. If you connected with me because you saw one of my free ebooks or one of my paid ebooks, in every ebook that I recommend and that I market and sell, I always at the end include If any of this resonates with you, if you need assistance in any of these areas, connect with me for 15 minutes. If you reach out to me for anything, I'll say get your own treatment plan. If you need help, connect with me for 15 minutes. 15 minutes is free. What I do is I listen to you and I listen to your concerns. I share with you, yeah, if you've been working on this for a long time or you haven't had any success or you visited a derm and you still have questions or your current treatment plan is not producing the results that you need, you probably need a little bit more targeted assistance. If you've been taking a specific vitamin that I'm not going to mention for a number of months and it's still not producing the results you want, you probably need more of a targeted assessment. This is what I do after meeting with you for 15 minutes. You share with me whatever it is that you're experiencing. I tell you which of the 3 platforms will work best for you. Now, here's the thing about my platforms. I have platforms that will service any budget because women and men, they're quick to say, well, how much is it? How much is it? When you are having a challenge with your hair and scalp, I suggest highly that you meet with a professional. Spare the expense because if you don't, because you're not seeing the value in meeting with a professional like myself, price is always an issue in the absence of value. I come on and I try to share so many different things to provide you value. The people that eventually meet with me find value in what it is that I share because it strikes a nerve. So I'm trying to strike the nerve for people who are blood type B and have diabetes risk or they're currently diabetic. That's the nerve I'm trying to strike today. I'm trying to help you get your personal treatment plan. We have a very low entry level treatment plan assessment. It's an hour. I give you a hair and scalp exam. I also give you a virtual scan, or you can come in person and get a scan. You can even send me your blood work. That is an hour. We have one platform. Then I have a platform where we loop in your blood type. we evaluate your nutrition. We're looking at your blood work, or we provide you with some sort of scan here in our establishment. And then we're also doing a hair and scalp exam. We're taking images so that we can tell you what it is that we see and tell you, okay, this is what you need to do. We're going to be looking for both of those platforms. We're going to be looking for inflammation. We're going to be looking at the quality of your scalp. We're going to be looking at the types of follicles that we see. We're going to look to see if there are open follicles, because if there are open follicles, your body is temporarily having a challenge filling that follicle with hair. I need to help you figure out why. It could be your diet, your lifestyle, not getting in enough nutrition. It could be stress from a recent effluvium. It could be a virus that will cause a recent effluvium. It's my goal to find out what have you been experiencing and why you are having those associated empty follicles. And then I have my top tier program where you in everything that I just mentioned, your 1 hour scalp exam, your nutrition, your blood type, your bioscan or your blood work. And it also includes a fit test or an intolerance test so that you can find out what you need to absolutely include or remove from your diet. So those 3 platforms, any one of those, you can pick to be able to be served best with your needs. Now, with my top plans, I also include for people who have trouble finding the right things to eat, I include meal packages in the plans. I also include things like the Unicity Unimate products to help you balance your blood sugar. Now, this also helps you produce your own natural GLP-1s. I include products like that in your plan, or things like, I can't show this too much because TikTok will ding me. This is called Isochrome. This is from the Isotonics brand, and that helps clients balance their blood sugar as well. So in addition to helping my clients with their own personal treatment plan, it will come with different supplements. It will come with you having to change different lifestyle factors. It will come with recommendations of things like that to help support your GLP-1s, to help support your body's ability to handle its blood sugar. It may come with adrenal and stress support, because any of you know, I talk all the time, when you're having challenges managing your stress, it's going to elevate your cortisol, it's going to elevate your blood sugar, it's going to elevate your insulin levels. So if you're already having a challenge balancing blood sugar, you need to get some things into perspective. And that's what it is As a trichologist, that's what I do. That's the role that I serve. Good morning, sis. How are you? Thank you for joining me. As I said earlier, if you need, we also include healthy meals. Even if you just need one meal for dinner, I can help you navigate your meal plan by evaluating what your blood type is. We can go through finding out what your blood type is. And then for those who can handle it, who can handle that in their budget, I will also include in your treatment plan 7 days or 8 days of dinner meals for the week. If you need all three meals, I'll send you over all three meals. If you just need just dinner meals, or you need just breakfast and dinner, I can help you with that. That's what it is that we do. We rope that into your plan if you can handle it and your budget allows for it. So when you give your body what it needs, when you reduce a lot of your risk factors, when you change your lifestyle, and this is a lifestyle change, this is not nothing you're going to do for 30 days. When you're trying to get your hair back, you're trying to restore your hair growth naturally, you need to do this indefinitely until you have another scan and your scan reveals, okay, you can stop taking this, you don't need this, your body's handling this well. These are lifestyle changes. Please don't think that when you have a treatment plan with someone like myself that you're going to do this for 2 or 3 months and then you can go back to living how you're living. Because if you go back to living how you're living, you're just going to fall into the same patterns. It's just like when you're trying to find a mate. If you always run into a mate because you like bad boys and you run risks of dealing with nothing but bad boys, you are never going to get out of that cycle unless you stop dealing with bad boys. If there's street hustlers and these are the only types of guys you like because you like danger and you like that life, you're going to associate and reap the benefits of living that life. So it's the same with hair growth. If you keep going on the same path, eating the same, doing the same things, you're going to have more of the same issues. So you have to change your lifestyle, change how you're living, and how you do that is through your own personal treatment plan. You have to do things a little bit differently. For my diabetics, it's all about managing your proteins, your healthy fats, and your carbs. You have to do this. There's no way around it. I do have many people who are on different types of medications, and of course, I can't mention the medication because sometimes I'll get dinged. If you want to consistently keep eating the same foods, keep taking the medication, and you think you're going to change something, you're just facing an uphill battle. You're never going to change if you don't change what it is you're putting into your mouth and what's on the end of your fork. There are so many different apps, especially I have that app, the Yuka app for my phone. I'm going to pull it up. And most of my clients, when they come to me, I put everything in a Yuka app and I share with them. It has a little carrot. I share with them the benefits of them eating that particular food. It'll show if it's a processed food, what kind of chemicals are in it, and if it's a good food or product for you. Because I share all the time that these processed foods, they come with a lot of salt, a lot of sodium, a lot of products, a lot of phosphates. These things mess up your liver, mess up your digestion, mess up your nervous system, and they're just not good for the long haul. And I share with everyone, at least for one meal a day, you need to create your own meals at home. Stop eating things in a box and out of a bag and out of a drive-through window. Stop eating so many prepared foods at work and on the run because they are not good for you. Reach out and try to get whole foods for your body because whole foods serve you best. We have the same 24 hours that our parents and our grandparents do. We have the same 24 hours as how you use them. Everyone is running on empty, running scared, not eating. And if they are eating, they're not eating the right types of foods for their body. And you said, yes, you love the app. And maybe can you make an appointment? All of my information, if you tap here, first tap this little white box here, tap that and help TikTok by helping us remain valuable to you by tapping this and getting in all your points. But tap that name right there. My bio will come up, and the bio will share with you how you can connect with me through the website. You can connect with me with your own 15-minute call, and we'll talk more. So that will share with you how you can connect with me. And Miss Renee said, of course, if meal plans are essential, you have to be intentional. I follow a gentleman. He's one of my coaches, as well as Myron Golden. And they say, be strategic. And anything that you talk about and anything that you do has to be intentional. So when you're trying to correct your steps and change how you live, you have to be intentional with it. Sometimes I'm hungry here at work, and there's a Chick-fil-A, there's pizza, there's a Dickie's. It's so many fast food options that are available to me. What do? I opt for a salad. I opt for something where the foods can incorporate the blood type foods for my diet. I have lived with upper GI distress all my life because I'm an AB. Like I said, ABs have trouble digesting food. We are not able to eat all of the fatty meats and products that are out here that are much suited better for being an O because it doesn't work well for our bodies. So because I have problems digesting food, I have to take my digestive enzymes, I have to take my bile acids, I have to take different things to help me digest food because I have the upper GI stress, it gives me problems below because the whole stream, stomach, small intestine, esophagus, large intestine is all connected. So if you have problems above, it will give you problems below. And I learned this working through Nadia Hughes in the holistic practitioners of psychology. So when you associate yourself and you learn these things, you're able to serve yourself better and serve others better. So this is what it is that I do, everyone. And I help you with your own personal treatment plan. Hairstylists, if anyone watches this stream later and gets to this end, I promise you, you can serve your clients best when you learn things like this. Help your clients, help yourself, help your clients understand that all they have to do is change some things when you receive data from them. Your clients have to give you data in addition to you standing over them every day, you looking at their scalp, seeing what they're dealing with. You see that they're having a challenge and you want to be able to help in addition to giving them the best bound slave style. Sometimes you need to help them in different ways. Now, this isn't for the faint of heart. This isn't for everyone. My sister, Miss Renee, who's on here joining me on TikTok, she is a certified trichologist. I'm a certified trichologist. What it is that we do, this is not for everyone. It requires a lot of study, a lot of training, and usually courses in trichology and being a hair loss practitioner is usually 2-year minimum. So I took a 2-year training to become a certified trichologist, and I have taken subsequent trainings so that I can be well versed in a lot of things to offer a lot of value to you. So hairstylists, if you want to learn how to become a hair loss practitioner, I have an online virtual training program, and I have a 3-day condensed program here in New Jersey. Either of these ways will help familiarize you with learning how to be a hair loss practitioner. Our clients are out here suffering. They're experiencing thinning hair. They're on different medications because of their diet and lifestyle and how they're living. They're experiencing so many different things and they have no help because they don't know what you know. All they know is what their physicians are telling them, but their physicians are not hairstylists. Their physicians are not hair loss practitioners. So hairstylists, if you want to learn how to be a hair loss practitioner, make it happen. Sit at home. After you get off work, then you do your study and your work at night and on the weekends. Learn how to be a hair loss practitioner. I have 2 platforms available to you, an online virtual and a 3-day in-person condensed version. Learn how to be that stylist that provides extra value. There are people all over looking for professionals, but stylists don't want to learn. They say, oh, I know that already. Oh, I know that already. Oh, I know she's taking medication. It's going to show that she's having thin hair. It's more than that. It's becoming well versed in a lot of different things to help your clients provide a different level of value. I promise you, once you learn this, you become so much more valuable in addition to being just a hairstylist. You can be a hair loss professional. I'm a hair loss professional. I provide non-surgical hair replacement, and I also train those with Renee to help others learn how to be a non-surgical hair replacement specialist. If you are within the sound of my voice and you need help with your hair and you need your own personal plan, please reach out. I have 15-minute calls that are free. All you have to do is connect with me, tell me a little bit about what you're experiencing, and I will share with you what it is that we do. I'll share with you which plan may be best for you, and I will share with you either you can meet with me virtually or in person. But either way, I can help you skin this cat. If you're having any problems with your hair and your scalp, I can assist you. You just have to reach out. If you have a hairstylist or a hair loss practitioner or a trichologist in your area, I encourage you to meet with them. If you want to get your hair back, you have to do the work. You're welcome, Ms. Swan. I appreciate that you said thanks. You have to do the work. Sometimes you need another set of eyes, and I'm here to provide you that second set of eyes if you need them. Of course, like I said, I have 3 different budget programs available to meet your needs. If you need meal plans incorporated into your treatment plan, I can help incorporate the meal plans into your treatment center treatment plans. I'm so sorry. If you want treatments, we do treatments here. We tell you what it is that you need to do to your hair and scalp so that you can restore your hair growth if it's possible. We help you identify if there are any follicles, what types of hair follicles your hair currently has. If you're dealing with um, different types of biofilms and different types of scarring patterns on the skin and scalp, like frontal fibrosing alopecia, uh, fibrosing of any areas of the scalp. I had one client who had fibrosing on the left side of her head, and that is usually associated with different patterns holistically and endocrine issues and problems with a male in the family. When things happen on the left side of the head, that's usually more associated with endocrine issues and problems with a male at some point that you were dealing with on one side of the head. There are certain things that just present themselves that I am already just in tune with immediately. And then when I start digging, I'm like, that's just what I suspected. So I credit a lot of what I offer through the training from the holistic practitioners of psychology. In my training, I don't include those holistic concepts because you have to go to the holistic practitioners of psychology course and learn those things. When I teach you and train you on my platform, it's just how to assess and learn how to become a hair loss practitioner. It doesn't include holistic concepts because that's something that she does in her program. So if any of you need me, please reach out. You can reach out by just sending me a message in my inbox. You can leave me a comment and I will address it and I will connect with you if you need me. I'm here for any of you because this is what I do. I always just pray to God to allow me to learn something and share it with you guys, hoping that it will be valuable to you. So like I said, all I need is this to resonate with one person. If it resonates with one person and they are helped, that's all it is that I'm looking for. And if you have any friends, loved ones, or anyone in your space who is a diabetic, who may be a blood type B, who may be dealing with any hair and they don't really know what to do, please just tell them to reach out because I'm here. And Renee said, especially before you send your clients off to a dermatologist who barely deal with the service externally. Yes. So a dermatologist is only going to do certain things because they are skin specialists. They're assessing for erythema, redness, swelling, breaks in the skin, cancers, and different things like that. Are they specialists with hair and hair loss? Not necessarily, unless they have specialized themselves in it, like Dr. Osei Tutu in New York, or Dr. One of my Facebook friends, Kimberly Jenkins, she works for a dermatologist's office. Dr. Bauman, Dr. Alan Bauman. There are many dermatologists who have specialized themselves with hair because it's a specialization. Not all dermatologists are well versed with hair issues because you have to specialize in that. So many of you reach out to dermatologists and you feel unfulfilled. You can't be mad at them because they are skin doctors. They're not hair doctors. When you want hair help and hair assistance, you have to reach out to people who specialize in hair issues, like a trichologist like myself, or someone in your area. So again, if you need any assistance, if you're a hairstylist, I got you. If you are a potential client, I got you. But you have to find value in what it is that we mentioned so that we can provide the value to you. If you don't value yourself, if you think you can fix it yourself, please let me ask you, how is that journey going for you? If you've been trying to fix it yourself for the longest and you've had no success, how is it working for you? So I say that with all love, that you all have to find value in things and stop being so closed in, closed off, saying, I'm not paying for that. I'm not paying for that. Sometimes when you want relief, you just got to bite the bullet. And our services are not expensive. It's just you have to find value in what it is that we do so that we can help you with your needs. If you don't reach out, you can't ever get any help. So Ms. Gail says, you don't know how much I appreciate you. Been dealing with this for years. Thank you, Ms. Gail. If you find value in this, please share this live. After I close this out in a couple minutes, it will be available on Facebook. Please share this out with your girlfriend or someone that you love, because this is what we do. We just try to share value with you. Again, if you guys need me, leave me a comment, leave me an inbox. You can reach out in profile on Instagram. All you have to do is go to the profile. On TikTok, just go to the profile. My information is there. You just click on it. There is a 15-minute link where you can connect with me for 15 minutes for free. Or you can just go to the website, send me a message in the chat, and I'll send it to you. Or my AI receptionist will send it to you. And again, if anyone reaches out to me through the website, I have an AI receptionist. If you guys don't like dealing with AI, don't visit my website, because I can't always answer every question 24 hours a day. And I do have an AI receptionist. If you call me, my AI receptionist will answer, and she will help you with whatever appropriate consultation or whatever issue she can, because I am not going to answer the phone on Sunday. I'm not going to answer the phone, and I'm not going to answer the phone 1, 2 o'clock in the morning when y'all see these posts. So if you don't feel like dealing with the AI receptionist, don't visit my website. That's why I have it, so you can have an immediate response and an immediate answer. And then when I check my messages during normal business hours, I will get back to you. But if you need me, please visit my website, visit the profile on Instagram and TikTok. Scroll through, see what can help you, whether it's one of my free books, my free guides, a 15-minute call, watching some of my streams, going to YouTube, watch some of my streams on YouTube. However it is that I can help you and assist you, please do it. Please go through my social pages on SBO Hair Loss and Wellness on Facebook. Go through my streams on Instagram. Go through some of my streams on TikTok. See how much value I try to provide to you as a community, and then make a decision. Because I'm just here to help and provide value to you. Hopefully I can. If I don't, I apologize. But hopefully this made sense to just one person today. And with that, I'm going to go, and I thank everyone so much for joining me, because you could have been doing something else with your time. If you need me, just reach out. I'm here. And you will see clips of this particular discussion. I'm going to be posting clips during the week on all of my social pages. So you guys have a wonderful day on purpose, and I thank you again for joining me. Bye, everybody.